Today our topic is common brain diseases, causes, symptoms and treatment. We are going to learn about these. Introduction. Hello everyone, welcome back to our channel. Today, we will learn about common brain diseases, their causes, symptoms, and treatment options. The brain is the control center of our body, responsible for thinking, movement, memory, and emotions. When the brain is affected by disease, it can seriously impact daily life. What are brain diseases? Brain diseases are medical conditions that affect the structure or function of the brain. They may occur due to infections, injuries, genetic factors, or lifestyle problems. Some brain diseases are temporary, while others can be long-term or life-threatening. Common brain diseases. Some common brain diseases include stroke, occurs when blood flow to the brain is blocked or reduced, causing brain cell damage. Brain tumors, abnormal growth of cells in the brain that can affect brain function and pressure. Epilepsy, a neurological disorder that causes repeated seizures due to abnormal brain activity. Alzheimer's disease, a progressive condition that leads to memory loss and decline in thinking abilities. Parkinson's disease, a disorder that affects movement, causing tremors, stiffness, and slow motion. Meningitis, an infection that causes inflammation of the protective membranes around the brain. Each of these conditions affects the brain in different ways. Causes of brain diseases. The causes of brain diseases vary from person to person. Common causes include infections, bacteria or viruses. Germs can infect brain tissues and cause inflammation or damage. Head injuries or trauma, accidents or falls can injure the brain and affect its normal function. Lack of oxygen to the brain, reduced oxygen supply can lead to brain cell death and permanent damage. Genetic or hereditary factors, some brain diseases are passed from parents through genes. High blood pressure and diabetes, these conditions damage blood vessels and reduce blood flow to the brain. Unhealthy lifestyle habits, smoking and alcohol use increase the risk of brain damage and disorders. Symptoms of brain diseases. Symptoms depend on the type and severity of the disease. Common symptoms include headaches or dizziness, frequent or severe head pain and loss of balance may indicate brain problems. Memory loss or confusion, difficulty remembering things or thinking clearly can signal brain disease. Seizures or fits, sudden uncontrolled movements or loss of awareness occur due to abnormal brain activity. Difficulty in speaking or understanding, trouble forming words or understanding speech shows brain involvement. Weakness or paralysis, loss of strength or movement in body parts suggests nerve or brain damage. Changes in behavior or personality, unusual mood, attitude, or behavior changes may be linked to brain disorders. Early symptoms should never be ignored. Diagnosis. Doctors diagnose brain diseases using several medical tests. These may include physical and neurological examinations. Doctors check reflexes, balance, coordination, and mental alertness. CT scans or MRI scans, imaging tests create detailed pictures of the brain to detect damage or tumors. EEG tests. This test records brain electrical activity to identify seizures or abnormal signals. Blood tests. Blood analysis helps detect infections, inflammation, or underlying health problems. Early diagnosis helps in better treatment and recovery. Treatment options. Treatment depends on the type and stage of the brain disease. Common treatment methods include medications. Drugs are used to reduce symptoms, control pain, or slow disease progression. Surgery. Surgical procedures remove tumors or repair damaged areas of the brain in severe cases. Physical and speech therapy. Therapy helps patients regain movement, strength, and communication skills. Lifestyle changes and rehabilitation. Healthy habits and rehab programs support recovery and prevent worsening. Long-term care. Ongoing medical support is needed to manage chronic or progressive brain diseases. Proper medical care can greatly improve quality of life. Prevention tips. Some brain diseases can be prevented by healthy habits such as eating a balanced diet. Nutritious food supports brain health and proper blood circulation. Exercising regularly. Physical activity improves blood flow and keeps the brain active and healthy. Managing blood pressure and sugar. Controlled levels reduce the risk of stroke and brain damage. Wearing helmets. Helmets protect the head and prevent serious brain injuries during accidents. Avoiding smoking and alcohol. These habits damage brain cells and increase disease risk. Prevention is always better than cure. Conclusion. To conclude, brain diseases can affect anyone, but early awareness, diagnosis, and treatment make a big difference. Taking care of brain health is essential for a healthy and active life. Thank you for watching. Don't forget to like, share, and subscribe to our channel. Stay healthy and take care. I am glad to share this experience with you, and I hope it inspires you too. Our educational videos make learning simple and interesting. With useful lessons and good ideas, they help you grow every day. Thank you for watching. For more good videos, please like, share, and subscribe. G. Sobhanadri Rao.